Okay, good morning, everyone, and welcome to our conference. I think it is our fourth conference working with our CTSA funded partners at Georgetown, Howard, MedStar, and the VA, Children's, and GW. Some housekeeping. I think you are all accustomed to these Zoom conferences, which means if you have to take a nature break, you don't have to step over other people in your aisle, and you get to control the climate in your surroundings. So there are some bonuses. And if you want to ask a question, please use the Q&A feature on the bottom of your screen. There is an anonymous way to ask a question if you do not want your name shared. The chat feature is if there's some technical issues, or go ahead and use the chat now and tell us where you're from and we can see that. And let me start by introducing our first speaker, Dr. Joseph Verbalis, Professor of Medicine, Chief of Endocrinology, Metabolism, and the Georgetown PI of the Georgetown Howard University Center for Clinical and Translational Science. So Joe received his MD from the University of Pittsburgh, completed his residency training at the Hospital of the University of Pennsylvania, and fellowship training in endocrinology and metabolism at the University of Pittsburgh. He remained there as a member of the faculty until 1995 before coming to Georgetown. His research has been funded by the NIH for the last 25 years and is concentrated on mechanisms underlying adaptation. I'm sorry, I have a phone call coming through, I'm ignoring it. Adaptation to hyponatremia, renal escape from vasopressin, osmotic regulation of hypothalamic gene expression, sex differences in physiology and pathophysiology, exercise-associated hyponatremia, and clinical use of vasopressin receptor antagonists. In 2007, Joe was awarded the Berthold Medal by the German Endocrine Society for outstanding scientific achievement in endocrinology by individuals who have excelled in combining both basic and clinical research. From 2003 to 2010, he directed the Georgetown MedStar General Clinical Research Center. Under his co-leadership, Georgetown and Howard were awarded a CTSA in 2010 to establish the Georgetown Howard University Center for Clinical and Translational Science, which has been successfully renewed in 2015 and 2020. And those of us at GW and Children's are very jealous because we are resubmitting ours with the July 15th deadline. So Joe knows our pain. I'm going to turn it over to you, Joe, to kick us off. Thank you for being here.
Thanks, Sheila. Yeah, I certainly do know your pain. It's a very rigorous process, but the rewards are substantial, and I'm sure you'll be successful as well. So good morning to everyone. I'm happy to welcome you as the PI of the Georgetown Howard University Center for Clinical Translational Science to this fourth annual CTSA Spring Regulatory Update, sponsored by the two CTSAs in the Washington, D.C. region. As you know from the agenda, the meeting this year will focus on the COVID-19 pandemic and our responses to this global crisis. So let me say a few words from my perspective as a clinical and translational scientist and physician about what I think the importance of this meeting is. As a physiologist, I know that one doesn't really understand the resiliency of living organisms until they are subjected to stresses, both internal and external. It is only then that we see the adaptations that they make in order to function and survive under adverse conditions. And as a physician, I also know that one must always balance the potential benefits of any treatments for disease and patients with the potential risks of those treatments. So these two physiological and medical principles that I have based almost all of my career on, adaptation to stress and balancing risk-benefit ratios, also apply to institutions. And for the purpose of this meeting, specifically to our regulatory agencies and bodies. I think our regulatory agencies have performed admirably during the pandemic to adapt to the stresses imposed by the pandemic and speed the translation of new therapies for treatment and prevention of COVID-19 infection, while importantly at the same time continuing to provide essential human subject protections and ensure scientific rigor of our clinical and translational research. However, we all know that there is always room for improvement. So the pandemic has now given us the opportunity, one of the few good things about the pandemic, to review what we've done, what worked well, and what still can be improved further. Understanding these aspects of how we dealt with continuing clinical research during the pandemic and what changes we made will provide a blueprint, I think, for adopting the lessons learned going forward in order to make sustained improvements in our clinical research infrastructure. So with that very brief introduction from my own personal perspective, I look forward to a vibrant educational meeting with very carefully selected great speakers, moderators, and panelists for discussions. I would hope that the discussions generated in this meeting will serve as the impetus to adopt and further improve new practices and how we can best support high-quality clinical and translational research, while at the same time providing the essential human subjects protection that we always need to do. So with that, I'll turn it back to Sheila, and I wish you all have a very educational, productive, and invigorating meeting. Thank you.
Thank you, Joe. As many of you who were with us last year remember, we pivoted quickly from an in-person format to an online format and used the pandemic to shape our agenda. And we brought someone in from Tony Fauci's team to walk through the epidemiology of the virus, and it was a fascinating conference. This year, we're